Okay. So I need to make a quick assessment so I have a sense of our level of competence. And again, I want to assure all of you, this is so Norbert and I can calibrate starting points. We're going to cover everything. But a quick exercise just to assess the general skill in the classroom. Okay? And it shouldn't take us long at all. Nobody's going to be called on. Nobody's going to be named. Nobody's going to be exposed in any way. It's really for our calibration. Simple. And this is a simple, basic rapport exercise. But I think you all understand how important that pattern, one of the key pillars of the hypnotic method, is. Okay? And then afterwards, of course, we'll be listening, we meaning Norbert, because I don't know German. You'll be listening in later exercises for your linkage expertise. And if it appears we need a little reminder or a little upgrade, we can take care of that too. The goal is everyone leaves here with a set of highly advanced skills. Okay? So this is going to seem elementary and simple for some of you, but please just go with that. We'll be done shortly. Okay. Here's the exercise. I want you to, as we did in the intro class, to separate into pairs and meet and greet. Remember, your greeting is your first opportunity to put nervousness or anxiety in the past and to establish and begin maintaining the rapport pattern, right? Okay, so it might go something like this. Hey, it's nice to meet you. I don't know about you. I had, past tense, I had a little nervousness coming into the class. It's good to work with you. I feel better already. Something like that, right? And then you want to agree on the goal. And the goal is simple. Let's do this exercise together. It's rapport. We've been practicing already. Should be easy. Okay? And just as before, one of you will begin describing a favorite place or something you did this past year that was really a pleasant experience. And as you describe it, try to describe it in all modalities. The visual aspect, the feelings or kinesthetic aspect, the sounds, auditory, smells, conscious or unconscious, the smells, and your thoughts, being there, what it was like, cognitive aspects. You don't have to hit all those, but be aware of them and bring them into your account of whatever the experience is that you're talking about, okay? And while you're doing that, your partner, of course, is aligning with you and getting rapport. And because you're skilled, you may be doing the same. You may now be at a phase where you can both tell a story and work on rapport too. So it's a little artificial because you both know what's going on. You're both attempting to do it. Don't worry about that. We're all going through the same thing. It doesn't have to be long when you're done. Just change over and let the other person recount their experience in the same manner. And the key is to be in rapport, right? which means this imitative pattern gets established. At the end of the day, somebody on the outside looking at it will see, oh, well, they're like mirror images of each other, right? And we see that all the time. Look at these two guys right here, right? It happens all the time, right? So to help you, I'm just going to be mentioning attributes. So you're going to have to be able to hear me or hear Norbert. Keep your headphones on. Yeah, you keep.
No, I'm on a speaker so everybody can hear.
Oh, okay, it'll go over the speaker then, okay? And I will say an attribute, Norbert will interpret it. I'll demonstrate here. So it may be, let's say, head position.
Kopfposition.
Or it may be eye blink, which I just did. Or it may be posture.
Oder die Körperhaltung.
Or it may be eye blinks,
Oder
head position,
Kopfposition, Kopfhaltung,
movements,
Bewegung.
like that. So I'll mention
Ich erwähne
the broad topic.
die grobe
You don't have to jump on it immediately.
sofort draufspringen.
Just work it into your rapport pattern in due time,
Muster ein,
right?
in nah in-
I'm doing that to help you, okay?
das, euch zu helfen.
For example, if I see that some pair of people,
Von Menschen
one person's laughing and the other's not doing anything,
macht nichts,
I'll say facial expressions,
Gesichtsausdruck.
right? If I see another couple where someone's listening attentively
Intensiv
and the other person is gesticulating,
gestikuliert,
I'll say upper body movement or hands or hints. I'll throw out hints to try to help you align better,
euch zu helfen, besser übereinzustimmen.
okay? And that'll give me an idea where we are in this thing, okay? At some point, you may hear me talk about breathing
Sage ich vielleicht was über Atmung.
in some way or another. And so your storytelling can stop if you need to get in the breathing pattern that I'm recommending.
Kann, sodass ihr euch auf die Atmung konzentrieren könnt.
Don't worry about that. The thing, though, is we have 50 people here. So we got 25 pairs.
Wir haben 25
We have to stay in this room so you can hear the instructions.
Instruktionen hören könnt.
So two things. One, spread out as best you can. You can use the stage. You can use this area.
Die Bühne, nutzt das Gebiet.
And talk softly. Talk softly. Because if everyone is talking at peak volume, you can't hear me.
Dann könnt ihr mich nicht hören.
And it'll become a mess.
Ein Chaos.
Talk softly. Yeah. It'll probably go on for, I don't know, 6 to 10 minutes at the most. And then we'll have a good idea.
Dann haben wir eine gute
Norbert and I will consult.
ich
And
austauschen.
we can use that as our base, and then we'll get started on practical applications from there.
Und dann von da aus beginnen.
Sound okay?
Klingt das okay?
It's simple.
Das ist einfach.
Yeah. If we had gotten up at 8 o'clock, Norbert,
8 Uhr aufgestanden
we
wäre,
could have done this exercise before,
jetzt schon machen können.
and we wouldn't have to stick it into the middle of the
Das nicht in der Mitte
teaching sessions. Doesn't matter. We have plenty of time. We got 3 days to learn a lot of really good stuff. So, any questions on the exercise at all? I didn't think that. It's pretty basic. Yeah, and forgive me for the basics.
Grundlegend
Your attention's a little bit split in this, right? Of course, you're going to attend to the person you're paired up with,
zur Person zuwendet,
but also be listening for our instructions.
hört auf unsere Instruktionen achtet.
All right? Pair up, meet and greet,
Ihr bildet Paare, trefft und begrüßt euch.
and then wait till you hear Norbert say go. When you meet and greet
Los.
and agree on the goal, decide who talks first, who talks
Vereinbart das Ziel.
second. Again, speak softly.
Und dann nochmal
And then when he says begin,
beginnen.
We'll all begin. Keep it down. Okay, let's go. Head movements.
Kopfbewegung, Kopfbewegung,
Head movements.
Kopfbewegungen,
Words, vocabulary. Upper body position. Upper body position. Eye blinks.
Augenblinken,
I think you have to say it a little louder. Okay.
turn up.
Okay. Breathing.
Atmung,
Breathing.
Atmung. Bitte jetzt auf die Atmung achten, den Atem synchronisieren.
Lower body.
Unterkörper,
Hand gestures.
die Handgesten,
Head tilt.
die Kopfneigung,
Softer. Softer.
leise, ein bisschen leiser,
Posture. Posture.
Körperhaltung,
And all together now, deep breath in
alle zusammen jetzt bitte tief einatmen, alle zusammen bitte tief einatmen.
and deep breath out.
Langsamer, tiefer Atem.
Stay in rapport.
Bleibt
Breath in,
tief einatmen,
breath out.
ausatmen.
Eyes closed
Augen schließen
and breathe out.
und ausatmen.
A color
Eine Farbe
and out.
und aus.
Eyes open,
Auf,
breathing,
atmen
and continue
und weitermachen.
staying in rapport.
Bleibt im Rapport.
That's right. Keep telling the story.
Jetzt erzählt ihr die Geschichte.
Continue getting rapport.
Geht weiter im Rapport. Ihr setzt den Rapport fort.
Head tilt.
Kopfneigung,
Eye blinking.
linken,
Voice volume. Voice volume. Movements. And again, deep breath in, everybody together. Deep breath in and out
Langsam ausatmen.
and in
Und wieder einatmen,
and eyes closed
schließen und ausatmen.
and in
Einatmen,
a shape
eine Form.
and in
Einatmen,
and out. Eyes open, continue on in rapport. So they're doing pretty good. I count 4. You tell me what you think. I see 4 that aren't really locked, but it's really 3 and 1 that's in and out and out. So, but they're good, don't you think?
Would you want to say something? Just
Okay. Very, very good. Very, very good. And stop.
und beenden. Und stopp.
Okay. Everyone has a paper and pencil? Okay. Paper and pencil. Only look at your paper.
Schaut bitte nur auf euer Blatt, nicht zum
Okay, don't look at your partners. And I'm going to ask you two just very simple questions. That was really good, you guys.
wirklich gut.
The group is better than I
Die Gruppe ist
had even hoped, so I'm encouraged by that. Okay, what I want you to write down
möchte, was ihr niederschreibt,
and shield it so you're writing it
dass der andere es nicht sehen kann.
is the color that you first thought of, not the one you settled on, the first color that came to mind. And if there was a different color you settled on, you can write that underneath it. It's one of these crayon boxes where you only have 10 crayons. You don't have 44 crayons.
Nur 10 Farben haben, nicht 40.
So it's not magenta, it's red.
Es ist rot.
Okay, it's not plum, it's purple. Okay, write down the first color that came to mind, and then if there's one after that, what you settle on, don't show it, just write it down, doesn't matter. Okay? And then, you got it?
Habt ihr?
Okay, and then now,
Jetzt
don't apply a word to it.
kein Wort.
Just draw the shape you imagined or saw.
Form, die du dir
Just draw it. Don't word it, don't interpret it, don't think what it is. Please just draw it.
einfach nur zeichnen.
Good? If you didn't have a color and you didn't have a shape, don't worry about it. That's not important. If you did, put it down.
Wenn ihr das hattet, bitte aufzeichnen.
Okay. So, remember, you don't have 45 colors. Let's make it easy. Okay, now consult with your partners. Whoever your partner was, I don't know if you're in the same place.
Tauscht euch mit euren Partnern aus.
And here's what I want by a show of hands.
Was ich möchte. Ihr zeigt die Hände.
Is yours on? Is it working? All right.
but only on the headphones.
That's fine. Yeah. We're good. Okay. Okay. It shouldn't take really that long to.
Dauert nicht, dauert wirklich nicht so lange.
Okay. Are you guys with me now?
Seid ihr bei mir jetzt?
Okay. So, how many pairs
Wie viele Paare von euch?
had, well, just so you know, I'm going to ask you how many pairs had the same, how many pairs had close to the same, how many had different. So think in those terms,
Wie viele waren anders?
okay?
Also gleich, ähnlich oder
Within those 10 colors, okay? How many pairs had the same color?
wer? Wie viele Paare hatten
So, okay, well, so we got to count that. I don't know, I'll divide it by 2. So if you're in the pair, raise your hand so we can. No, were you in with him? So everyone who's in the pair.
Bitte aufstehen, zählt sich einfach.
Okay, well, how many do we have? 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, 30, 32, 34. So we have 17. Jeez. Okay, you can sit. Okay, why don't we just stop for a second here, okay? Let's just stop for a second there. Something remarkable just happened.
Was Bemerkenswertes ist gerade passiert.
If I had said to you beforehand, by the way, these pairs had different colors. Let me give you an example. What color did you guys have? Blue. And who's another pair back here? Green. And how about in the back there? Blue. And who else? Huh? Yellow. And who else? Red. Okay. And red there. So understand this, that the sameness happened within the pairs,
Innerhalb der Paare,
not throughout the entire group.
nicht in der ganzen Gruppe.
Who were you in rapport with?
Wem seid ihr im Rapport?
The one you were in rapport with. Now, think about this. Okay? Simple experiment. Of the 22 pairs we had, we agreed that one pair was sort of in, out, in, out. I think they got distracted by something. So we had 18 pairs that were, according to our estimation, in tight rapport. Okay, so that's our denominator. And we just had 17 out of 18 pairs without talking to each other about it, have the same idea.
Die gleiche Idee.
Have the same idea.
Gleiche Idee.
They happen to be an idea of color, but it's an idea.
Das ist eine Idee der Farbe.
Okay? Just want you to ponder that for 1 sec.
Dass ihr darüber mal ein bisschen nachdenkt.
All you did was a rapport exercise, right?
Ein Rapport übt.
I didn't say, think of a color. I didn't.
Denk an eine
I said a color.
Farbe. Nur gesagt, eine Farbe.
I didn't say this is going to be a mind-matching experiment. I just said I'm going to observe externally to see what your level of rapport skills is, which truly is what we were doing here. And now we know we have a very high level in this class. We can go full bore after this. Okay? Now, remember, same, partially the same, different. Those are the categories. Again, consult with your partner. Look at the shapes
Vergleichen.
and
Euch die Formen an.
see if they're the same, if they're partially the same, meaning they share elements, or if they're different.
Haben gemeinsame Elemente.
Everyone get that established first, come to agreement, and then I'll ask you. Don't you just love it? Don't you love it? You love it. Okay, we good? Okay, so pairs again.
Wieder die Paare.
Pairs who had the same shape or really, really close, please stand.
Ziemlich ähnlich.
2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 26, 28 is 14. Wow. Okay, so same is 14 out of 18. Similar but not identical. Those people stand.
Identisch. Also die, wo gleiche Elemente.
It's good. Okay. So 1 out of 18. Pairs who had completely different shapes.
Und ganz verschieden.
Stand so I can see it. Okay. 2, 4, 6, 8. Different, completely different. Okay. Okay. 2, 4, 6, 8, 10, 12, 14, so 7. That doesn't add up. Oh, I see, it does, because we had that. Okay, so this would have been over 25 because we had the different. So this is out of 25, 25. Because different, we'd expect 4 of you to have different. Okay, you can sit.
Wir hatten erwartet, dass 4 nicht so ganz passen, aber dann
So if we take these two, and we say out of the ones that were in rapport, we have 15 out of 18,
15 von 18.
right? Okay, in other words, look at what just happened. Of the pairs that were in rapport, and we're saying there were 18 pairs that did a great job of that. I have to say, you guys could not have predicted this,
Ihr hättet das nie vorhersehen.
right? Because you're walking into this world. I'm going to exaggerate this a little, so let's all understand that. I'm exaggerating for effect.
Übertreibe.
You're all individuals,
Wir sind alle Individuen.
right? You have your own separate minds. You have your thoughts, they have their thoughts.
Der andere hat auch seine.
They don't mix
Die vermischen sich.
unless we verbalize our thoughts and express our thoughts, right? That's the basic philosophy
Grundlegende Philosophie.
of Western European civilization. And yet, of the 18 pairs, 17 out of the 18 somehow, without words,
Ohne Worte
conveyed the same information as to color to each other non-verbally.
übertragen. Nonverbal.
We don't know how that happened,
Wir wissen nicht, wie das passiert ist.
but we know
Aber wir wissen,
that it happened while you were in rapport.
passiert ist, während ihr im Rapport
And I'm going to remind you
erinnere euch daran,
that in this exercise,
dieser Übung
you're in rapport spontaneously. But look at these two people who are in rapport. I mean, methodologically, you're in it in the exercise, spontaneously. All 3 of these people are in the exact same position.
gleichen Position.
And do you really think that what happened in this experiment
Wäre in dem Experiment passiert.
isn't also happening there now? Seriously? Explain that to me. The other thing we showed that with a more complex information pattern, namely shape, that 15 out of the 18
10 von 18
either had the exact same or a similar shape somehow transmitted within the rapport pairing.
Also im Rapportmuster das transportiert.
What? You could not have expected that. Right? We could stop right here and call it a successful seminar. You can ponder that for a lifetime. Something fundamental, something profound is happening. And it's not just happening in this exercise. That would be one thing remarkable enough, wouldn't it? It would be quite noteworthy if we could set up a situation where somehow information between individuals is exchanged based on that situation. But it's more than that, isn't it, Norbert? Because now look at these three ladies who are all in the exact same position. And Thorsten. All four of them. Because this is what we do, spontaneously. We collapse differences. We collapse differences. I won't forget you. I'll come back. This is the law of collapsing differences at work. And what that law says, I'll write it out for you after lunch. What that law says is that the fewer the differences between any two systems, the more probable the sameness of any two events, any two related events in System 1 and System 2. You're a system, you and your partner. As you collapse the differences within that system, which you do by getting rapport, it becomes more and more likely that the next event that occurs within you, System 1, will also occur in her System 2. The law of collapsing differences. Whoa. Ponder it. Ponder it. And then ask yourself this. In my office, I'm often an authority figure. And I know people identify with me because I understand the law of identification. When they feel helpless and dependent, and when they perceive me as the one least uncertain, as the authority figure, they identify with me. And what we mean by that is my reality becomes their reality. A sameness occurs. There is rapport. That's why when you're in a situation, let's say in medicine, where you have maximum authority, maximum hypnotic influence, you don't need to think about rapport and linkage. They're already identified with you. They are collapsing differences actively to make their reality your reality. Just watch for that in the office. You'll see it. You scratch your head, they scratch your head. You cross your legs, they cross their legs. You uncross them, they uncross them. Differences are collapsing. And what you now know, and come on, these are pretty indisputable numbers. This wasn't like, oh, maybe. And the reason, by the way, is because of how good you guys are at this. And I'll assume you're this good in the office. When that happens, information is exchanged non-verbally. And that has profound repercussions. Because what if you walked into that office, you looked at the chart, you read it, and somewhere in the back of your mind you said, this guy is dead. I'll go in and do my best. Seriously? You want to walk in that office knowing that this is going on? What if you walk in that office and you say, and forgive me, I'm just being a human being up here. What if you walk in that office and you say, this guy is really an asshole and I hate spending time with him, and damn, I wish he would bust out of my practice. Is that fair? Is that right? Is that really what you want to convey? Now, I'm not telling you how this happens, right? Just like Sir Isaac Newton, he didn't tell you how that law of gravity worked, or any of the laws of physics, when they're first dreamed out, right? What did he say? I think it's an apocryphal story, because I know what he actually wrote. But the story is, he said, I don't know how, maybe angels are beating their wings. That's the story. But the point is, he didn't understand it. He just knew the law, and he knew that's what was going on. And so don't climb all over me for, hey, you're a believer in this or a advocate of that. No, I'm not. I'm not telling you how. I'm saying there's a law of collapsing differences. And in accordance with that law, which is very simple, the fewer the differences between two systems, the greater the probability that one event within system one will equal that event in system two, and vice versa. That's all I'm saying. But you just saw it. Not once. You didn't see it just once. You saw it twice in what? 10 minutes. So in the introductory course, think about this. This is, am I the only one mind blown in this room right now? Am I? Because if I am, I'm cold and lonely. And you don't want me feeling cold and lonely, do you? In the introductory course, we talked a lot about how we express ourselves, both verbally and with gestures, right? Underscoring with eye, voice, hand, speaking permissively, metaphorically, and indirectly. We talked a lot about that, these channels of communication that we're perhaps overly familiar with. But we just learned something really, really important. When I walk into an office, whether it's Dr. Ron, who had his pancreatic cancer surgery and thinks he's going to die, or whether it's any of the other people I'm going to tell you about in the course of this advanced causes and cures course, I know this is going to happen. And so do you now. And so you don't have to just watch your words. I know that's hard enough. It's like, oh my God, I can't even text this guy without realizing that I have to be Careful what I say because I have hypnotic influence.
Ich muss aufpassen, was ich sage, weil ich habe Hypnotik.
That's a bit of a burden, isn't it? But it looks like I'm not lightening that burden this morning. Because I'm saying not only do you have to be careful and deliberate and intentional with your external expressions, but none of us are hard, encapsulated individuals impervious to outside influences. None of us.
Unbeeinflusst von äußeren Dingen. Niemand von uns.
So guess what?
Ratet mal was.
You have to guard your thoughts too. You have to guard your thoughts. And let me assert that because this happens and it happens regularly, don't go in that room unless you have curative intent. You must have curative intent. Of course, there are exceptions. I know end-of-life exceptions exist. I'm not talking about those moments. When those moments come and a competent, non-depressed, reversible depression individual says, I'm done, help me check out. That's a different realm. Okay? And I have respect for that. I get it. But that's not what we're talking about. When someone comes to you for help, you best be clean in the head too. He's absorbing it. He's taking it in. Before you ask that question, take a moment to congratulate yourselves on this. This is rather remarkable, isn't it? You learned a skill last time, and then you executed that skill impeccably. And because of your impeccable execution, you discovered something of profound importance. Profound importance. And this will make you a better healer, I promise you, so long as you remember it. Right? You like? Okay.
I was just waiting for the resonance of your words. I don't want to talk over it.
Oh. Do you have a
I've just a
question, though?
remark.
Don't worry about talking over it. I think everyone, you guys get this, right? We all participated in this together. We're all experiencing it together.
It's just an affirmation of what you said.
Ah, very good.
You were even more successful than you thought to be with this experiment, because we had different shapes, different colors, because we were in such a good report, I guess, that we had a report of opposites, a harmony of opposites in the sense of Heraclit, perhaps. She took over my color, perhaps also my shape, and I took over her color.
Okay. I understand what you mean by the initial comment. We'll set that aside for the time being. Noted.
That was all.
Noted. Okay. Any other questions?
Ich würde sehr gerne wissen, wie kann ich das machen, wenn ich bei der Arbeit bin, wenn ich
When I'm at work,
im Stress bin,
under pressure,
Wie schaffe ich es,
how can I do it?
dass ich die Ruhe bewahre und dass ich dann mich auf den Patienten
And to
einstelle,
be able to tune into my patient,
dass ich auf meine Gedanken achte und
to mind my own thoughts.
Okay. So yeah, of course, this is somewhat daunting, okay?
Etwas bedrückend.
It places on us, at first, a seemingly
Uns eine
immense,
ziemlich
almost impossible responsibility, right? So, step one,
Schritt 1.
like the rest of us,
Wie der Rest von uns.
you're just a human being, you know.
Nur ein menschliches Wesen.
There are times you will be tired.
Zeiten,
There are times you will be overworked. There are times people outside your life will drive you, outside your work life, will drive you crazy. There are times people inside your work life will drive you crazy. So none of us can be perfect every moment of every day. And we should all acknowledge that right here and now. All you can do, honestly, truthfully, you're talking to an emergency physician, right? 20 years, one doc, 4 ambulances coming in at a time. All you can do is your best in any moment. That's all you can do. And so do your best in each moment. But right now, today, and I'll wait, you tell me when you've got it, just forgive yourself for whatever mistakes might happen in the future. Let's get it over with right now. Let's just forgive ourselves. We're not going to be perfect. We can aspire. We can get better with each passing day. But let's just forgive ourselves. No matter what you do, having awareness of this phenomenon we all just witnessed, makes you better than you otherwise would have been. And in that moment, that's the best you could do. And trust me, I mean that from the bottom of my heart because I've been there.
Von tief, vom Grunde meines Herzens. Ich bin da gewesen.
I'm very encouraged by this group.
Sehr ermutigt durch
Why don't we move on?
gehen wir nicht weiter.
Ready? You liked that, didn't you? All right.
That's what it is. This must be the downside.
Is my zipper zipped? Are my buttons buttoned?
Reißverschluss zu, die Knöpfe zu.
How's my tie?
Wie ist mein Schlips?
Okay. Think what we're learning here, right?
Was wir hier gerade lernen,
We learned that there are some
dass es
subterranean, some buried ideas in our patients, like Dr. Ron,
grundlegende Ideen geben kann, wie
or the guy who was happy about his brain tumor.
bei Menschen, wie der glücklich war über seinen Hirntumor.
These sort of buried ideas that have profound effects.
Haben einen grundlegenden Effekt.
And at the same time, we learned
In der gleichen Zeit haben wir gelernt,
that profound effects are happening unconsciously inside of us,
innerhalb von uns,
between other people.
zwischen anderen Menschen.
You could think about that one for a lifetime,
Darüber ein Leben lang nachdenken.
right? Do your best to keep
Mach
curative intent in the forefront of your mind,
in der Vorderfront deines Geistes.
okay? How do we begin to dig out
Wie beginnen wir,
those buried ideas in our patients. I was reading a beautiful essay by a Canadian writer, Robertson Davies. And it's entitled, Can a Doctor Be a Humanist? Can a doctor be a humanist? Yeah, the reference is in the back of my book. And while I was reading it, I started to realize I can use my technique and my skills and craft one little question, and if I do it right, maybe, just maybe it'll work. And I couldn't wait to get to work. And so, next time, my next shift in the emergency department, I get in there, and it's a crazy busy day. And I was hoping for a slow day because I really wanted to try out this question I'd figured out.
You're hoping for a slip?
A slow day.
Ich habe auf einen langsamen Tag gewartet.
But it's crazy.
Aber es war verrückt.
Yeah, but I'm a little crazy too.
Aber ich bin auch ein bisschen verrückt.
So I grab a chart, my first case,
Vom ersten Fall.
and it says 43-year-old gentleman, left testicular pain.
Schmerz im linken Hoden.
I think, this isn't going to be too hard. So I go in there,
Ist nicht so schwer. Also ich komme rein,
do all my usual stuff, meet and greet, get rapport,
Zwischending, wir treffen uns,
ask what's going on, do the exam.
führen die Untersuchung durch.
And it's not his testicle, it's just above the testicle, this little organ,
Der Hoden ist der kleine
super tender, inflamed.
empfindlich entzündet.
And I get the appropriate tests and make the diagnosis. He's got what's called epididymitis, above the testicle. It's inflamed. And the cause of that, you know, there's probably 40 or 50 potential causes. Yeah. Inflammatory, infectious, autoimmune, et cetera, a whole gamut.
Die ganze Spannbreite.
Yeah, I'm not going to figure it out that day. But the most common cause in that setting, that age, is an infection. I give him a prescription for an antibiotic and a referral to a urologist, and it's a busy day. So I got to get going. And I've done my job. I could leave right now and be fine. But the question is nagging me, and I have to try it out. And I know how to do it. You've heard me do it. I demonstrated it twice already. But this is the first time I've ever done it. And so I say to this guy, he's getting his pants back on, he's buckling up, zipping up. And I say, I'm out the door, and then I turn around casually, and I say, hey, you know, it's probably not important. But I'm just curious. What am I doing there? I'm handling potential resistance. If it's not important, if it's just my curiosity, why would anyone resist that? Right? I just helped him out. Maybe he wants to help me with my curiosity. I'm handling his resistance. I pushed it off to the side. By the way, it's probably not important, but I'm just curious. You could have had this 3 weeks ago or a month ago. And for that matter, I suppose, you could have had that 3 days from now or 3 weeks from now. You're not going to know, and I certainly don't know. But if you had to guess, why today? Just guess. And remember that word just? Just meaning and nothing more. Just guess, meaning don't think, don't reason, don't logically arrive at the answer. Just guess. And he said what they all say. And I've told you this, but let me tell you again. He looks over and he goes, I don't know, you're the doctor. You tell me. And so I have to pace that, right? I say, you're right, I am the doctor. And like I said, I don't know. And I don't expect you to know. But if you had to guess, again, why today? Just guess. And at this point, I'm thinking, yeah, maybe this isn't going to work. Maybe this was a stupid idea, and now I got 3 more patients backed up, and I shouldn't have wasted this time. And he finishes getting his pants on, and he turns around. And remember what I said, it often comes as a question. He turns around and he says, but hey, doc, do you think this is going to interfere with the vasectomy my wife wants me to get tomorrow? Ka-ching! I've got the magic question. Then I became a madman. I'm working in the ER. Got a heart attack victim. Same day. Get him stabilized. We're waiting for an ICU bed. Nice guy. I can still picture this guy. Had a beautiful wife, loving. And I said, you know, this lesion that causes the heart attack, that's been around for years. Slowly growing. I said, you know, the wife had already gone. She was down getting things squared away with the ICU, his belongings and stuff. So it's just me and him. I said, it's just you and me. You could have had this heart attack like a couple months ago, or God knows, maybe it's a couple years from now. I'm not going to be able to answer this. I don't know. And I know you don't know. But it's just one of these odd curiosities. I'm wondering, if you had to guess, why today? Why now? Just guess. You see what I'm doing is like I'm pushing all reason to the side. That's not going to help us here. And he said what they always say. Even when he's lying on his back, beginning his recovery from a heart attack. He goes, gee, I don't know. You're the doctor. You tell me. And again, I have to pace that. I want to maintain rapport. So I say, well, you're right. I am the doctor. But as I said, I don't know. And I don't expect you to know. But just curious. Remember, I'm evoking a whisper from the unconscious. Just curious. If you had to guess, why today? Why now? Just guess. Again, it comes as a question. He goes, you know, gee, doc, you think it has anything to do with the fact that my mother-in-law just moved in for a full year? A guy with aphthous ulcers. You know, these little ulcers you get up here in your gum. Never had them before, ever. Young man, I think he was like 24, 25 years old. And he's got a cluster up here, all over the same tooth, half a dozen of these painful aphthous ulcers. I see him, you know, I treat him the way we treated aphthous ulcers back in the day. Don't even want to tell you what that was. Why today? Just guess. You're the doctor, blah, blah, blah. Just guess. Well, I don't know, but is that going to interfere with the molar extraction they're planning to do tomorrow? Whoa, starting to see a trend here.
Wir beginnen hier ein
Friend of mine comes in, appendicitis,
Appendizitis, Blinddarm.
right? She's going off to surgery.
Sie geht
I have him stop the gurney. I say, hang on a second.
und Gurney, she's on the gurney.
She's on the gurney. She's going down to the OR,
Auf dem-
operating
auf
room.
der Trage, und geht
Hold on a sec.
in den Operationsraum. Ich sage, halt mal an.
I'm on a roll here, you know. I'm feeling good about this whole why today deal.
Bezüglich der ganzen Warum heute Geschichte.
And with this friend of mine, I'm particularly curious
Besonders neugierig,
because she's a really beautiful, healthy young lady.
voll gesunde, junge,
Hey, Candace,
wer kennt das?
appendicitis, you could have had that a week ago,
Dass das vor einer Woche haben kann.
or a year from now, or never for that matter. You're not going to know why, and I guarantee you I do not know why. I'm just curious, before you go,
Bevor du gehst.
if you had to guess,
Wenn du raten sollst,
why do you think you got this today?
hast du das heute bekommen.
And she looks at me,
Sie guckt mich an.
this is just a great, great gal. And she goes, you know what, Steve?
Weißt du, Steve,
I'm just an artist. You're the doctor, you tell me.
du bist der Arzt, du sagst es mir.
And I said, yeah, Candace, I am the doctor, but
Ich bin der Arzt,
like I said,
wo ich gesagt habe.
I don't know.
Ich weiß es nicht.
Just guess.
Einfach raten.
Why today?
Warum heute?
And this one was particularly interesting to me.
Besonders interessant.
I want you to think behind all these is a wish, right?
Dahinter denkt.
I wish I could get out of that vasectomy.
Ich könnte aus dieser Vasektomie,
I really don't want it. My wife wants it.
das nicht, meine Frau möchte das.
I wish I could get out of that tooth extraction.
Könnte den
I wish I could get out of this house that my mother-in-law is going to live in
Ich wünschte, ich könnte aus dem Haus
for an extended
für eine
time period.
extensive Zeitdauer.
Candace says,
Wenn es,
yeah, I don't know either.
weiß auch nicht.
But, you know,
Aber, weißt du,
we're not rich,
wir sind nicht reich.
and our insurance pays for anything that comes through the emergency room.
Durch die Notaufnahme,
So do you think while I'm in there,
während ich hier drin bin,
they can unclog my tubes
können Sie meine
because Phil and I decided we want a baby?
Eierstücke in Ordnung bringen, denn wir wollen ein Baby haben.
Ooh, yeah. Sorry, that's
Tut mir leid,
not going to work.
das funktioniert nicht.
Why today, just guess?
Warum heute? Einfach raten.
So here's our exercise.
Jetzt kommt unsere.
And you got to get this right,
Ihr müsst die,
because what this does is this opens the box. This one question opens the box. And if from this day forward you ask this question properly, as we're going to do now,
wie wir das jetzt machen werden,
to all or mostly all of your patients,
an unsere Patienten.
what you'll see is answer after answer after answer after answer. And they tend to fall, not all of them,
Tendieren,
but generally into 5 or 6 categories.
6 Kategorien,
And it's those main categories that we're going to discover and learn to treat in the remainder of this course.
im Rest dieses Seminars
But you got to ask the question properly,
die Frage angemessen stellen.
okay? So here's the exercise.
Also, das ist die Frage.
And let me ask for
Lass mich bitten,
a little brutal honesty.
ein bisschen brutal, klein wenig brutale
That's, by the way, that's Bertrand Russell's phrase, and I love it. Just brutal honesty with yourself,
der brutale
okay?
Ernst mit dir selbst.
Break into pairs, meet and greet, and agree on the goal. Okay, let's do this. Let's do our very best.
Begrüßt euch und vereinbart das Ziel.
I want you all to recall the last time you were sick.
Das letzte Mal, als ihr krank wart.
It can be small sick, big sick, doesn't matter. Just the last time you were sick. Not a big deal. Just
Keine große
pick that time,
Nur wähle diese Zeit.
okay? And then your partner will say to you, I don't know why you were sick, and I know you don't know why you were sick. But you could have probably got sick like a week before that or a week after that. I'm just curious. If you had to guess, why then? Why at that moment?
Warum in diesem Moment?
And then it's very important to say, just guess. They'll come back and they'll say, well, you're the doctor, you're the clinician, you're the therapist, you tell me. And you pace that. You say, yeah, I am the doctor, a clinician, a therapist, but as I said, I don't know, you don't know, I'm not sure we even can know. But if you had to guess, just guess. Doesn't really matter, just guess. And the important thing to do at that moment, silence. Don't say a thing. Let it percolate up. Sometimes it comes quick. Often in the form, as I said, of a question. Sometimes it comes slowly. It can take minutes. Don't say anything. Hush. Shh. It will come. Wait on it. Okay? It's a simple exercise. But it's really critically important because we're opening Pandora's box. And behold, these frequent causes of human illness. All right?